My name is Mushtaque Chowdhury. I am the Vice Chair of BRAC. And as you know, BRAC is probably the largest NGO in the world. We employ about 220,000 staff. And we are working in about 11 countries. But BRAC was born in Bangladesh, and it has actually excelled and become large in Bangladesh. We work in poverty alleviation and the causes of the poverty. So it's not only about income, for example, which you do by providing microfinance, but we also work on education, we work in health, we work in climate change, we work in women's empowerment. So that's how we do, and BRAC also believes in own self-supporting BRAC. So 70% of BRAC budget actually come from our own sources, which means that we are dependent on donors for about 30% of our budget. Well, you know, the Lancet, which is the prestigious medical journal, they have been doing these country series, and 3 years ago they decided to launch or start one on Bangladesh, because they thought that there is a story to tell about Bangladesh. So we have been working together with 35 authors and a steering committee to develop papers, and we have this series which has been officially launched in Bangladesh in November, which has about 6 papers and many commentaries and so on. So we thought that the story that we tell about Bangladesh is of importance and implication for outside world as well. So we have been visiting different capitals to tell about the positive side of the country, because recently there has been a lot of negative publicity about the country, what is happening, particularly because of the politics there. So we thought that we do have a positive story to tell, and we should take this opportunity, because what is coming from the Lancet is actually based on evidence, and we are showing there that the country has made huge progress in social development over the years. So just to give you an example, when Bangladesh became independent in 1971, the life expectancy was only about 42. Now the life expectancy has gone up to 69, and more importantly, there is a gender dimension to this, in the sense that until the 1980s, Bangladesh was one of the very few countries where women lived a shorter life. But over the years, we have been able to correct it. Now women live 2 years more than the men. So these are sort of very positive kind of development, which shows that a poor country like Bangladesh can also improve its health and well-being very fast. What Richard Horton did say about it is that Bangladesh is one of the great mysteries of global health, and there he refers to the paradox, for example. And the paradox is that we have achieved so much of good results in health, for example, but at the same time we haven't been able to do many of the other things which are supposed to be helping that. So for example, we have a bad governance, we have the politics hasn't been right, we have things like, for example, the income inequality is very high in Bangladesh, and also that some of the determinants of change in health. For example, if you want to reduce maternal mortality, you need to have skilled attendance. That is the conventional sort of wisdom. But we have seen that despite not having a good proportion of skilled attendance in Bangladesh, maternal mortality has gone down. So that's another paradox. but at the same time, I mean, there has been other improvements also. I mean, not only in health, but also in education. The net enrollment at the primary level has exceeded 95%. And there are more girls now in school than boys. So this is a huge achievement, which is not directly in the health sector, but has helped achieve gains in health. Also in terms of the proportion of people in poverty. About 20 years ago, over 60% of the Bangladesh were in poverty, defined by head count poverty. Now it has reduced to less than 30%. So we have made good progress in many different sectors. The takeaways from these are the following. One is that we feel that it's very important that you give a good role for women. That you need to empower women in your society, within your family and also in the society, in order to achieve what you want to achieve, because we feel that women are the engines of development, engines of change. So in order to develop anything, to make a real change, you need to have your women empowered. So that's one thing. Second thing is that in Bangladesh, for example, the NGOs have made a good contribution along with the government. It's not that the government is not working. The government is doing very well. There are problems, of course, but the government and the NGOs are working together. So the government has actually created a space for the NGOs to work there. And third, I think, is the importance of evidence. Bangladesh has a good history of health research, and we do research not for research's sake, but to solve a problem. So that's what we have been trying to sort of do. I mean, research has become a part of the culture there, and we sort of do things not on an ad hoc basis, but based on evidence. Very good question. Of course, I mean, we have achieved a lot, as just I've been talking about. And the kind of things that we have done are probably kind of low-hanging things, which can be done easily. For example, making people aware about ORT, having children immunization center, and so on and so forth. But then what is coming for us in the future are these kind of higher hanging fruits. So for example, the NCDs, the non-communicable diseases, are becoming more and more important. And in order to address that, you need a good health system. So vertical programs will not be very effective there. So the challenge is, how do you sort of build that health system which will take care of the emerging new issues that are coming. And also we haven't solved all the problems as yet, even current problems. So for example, there is a problem with respect to child marriage. So 60% of our girls are married off before 18 years of age, and this hasn't changed much. So that's part of the agenda now, that how do you really sort of increase the age at marriage for girls. We also have some sort of forgotten issues. So until the 1990s, we knew that we have solved the problem of drinking water, clean drinking water. Then we discovered that there is arsenic in our water, which makes that the water we drink are poisonous. But we haven't been able to solve that problem as yet. It's kind of forgotten now, but we need to do something about that. So there are set of persisting problems, there are kind of forgotten problems, and there are some problems which are coming in the future. The issue of urban health, for example. About 28% of the population are living in urban areas, and 1/3 of them live in slums. So we have to think about how to deal with the issues that urbanization brings. I think there are a lot of interest about the Bangladesh story, and a lot of learning, not only for us, but also probably for the outside world. So the challenge is, how do you really use that learning in order to improve global health?